Time now for the Spine Doc, putting you on the road to better spine health, featuring Dr. Pasquale Montesano, MD, world-renowned orthopedic surgeon and spine and joint treatment specialist at Montesano Spine and Sport, with offices in Palm Beach Gardens, Miami, and Naples. Dr. Montesano is a pioneer in the development and application of the revolutionary A2M treatment for lasting proven relief of chronic pain and discomfort in joints. Now, here's your host, Brian Content.
Hello, once again, and welcome to The Road to Better Spine Health with the Spine Doc, Dr. Pasquale Montesano, MD of Montesano Spine and Sport. 866-79-DR-SPINE, 866-79-DR-SPINE, or visit spinedocs.org. Find out more about Dr. Montesano's background, his history, his treatment methods, and whether he could be your alternative if you've been suffering from joint discomfort, pain, spine problems, whether you're recuperating from an accident or just not getting the answers you want, whether you're being recommended for surgery, you're uncomfortable with that idea, maybe you want a second opinion. Dr. Montesano has the expertise to be able to do the proper evaluation you need in order to get you on the road to better spine health. And hello again, Dr. Montesano. Your practice specializes in diseases and disorders of the spine. You also are a champion of a new procedure, which is called A2M, alpha-2 macroglobulin injections. And we want to focus on that because a lot of your patients and a lot of the people we're trying to reach out here today are sports-minded athletes, guys and girls who get out there and they overwork their body and maybe, start getting inflammation, pains here and there, discomfort that kind of grows, exacerbates itself, and can't find the remedy out there to make it better.
Brian, I think it's a first stop in your choices of treatment modalities out there. It certainly is the least invasive. The treatment can be delivered through a small caliber needle into whatever joint is involved, and I think the results are really outstanding. I think you have to also keep in mind that if the joint is too damaged, then this treatment is not going to be applicable. So it's not for every injury, but certainly is something to consider whenever you do have an injury.
Well, that would be something as part of an overall evaluation, which would be as part of a visit to you. Of course, you're dealing with traumatic injuries as well. You're a surgeon, but that is not something, certainly cases require surgery. There's no getting around that, but in a lot of ways, you avoid that at all costs and try and work from, simpler methods of treatment and consider that maybe a radical step to take in a lot of the cases.
That's correct, Brian.
So how do you begin determining how to go about prescribing a course of treatment for somebody who comes in and says, hey, look, doc, my back has been acting up. I just, I can't recall an actual injury or something that occurred, but it's just, I got this terrible back pain.
Well, like always, Brian, you start with a careful history, and the history involves basically getting the patient to tell you a story. But there's certain aspects of the story that are essential, so you have to guide the patient. There may be things the patient wants to tell you that aren't really that important, and some things the patient is overlooking that are more important, so you have to guide them to obtain the proper information. So we say that 80% of making a diagnosis is listening to what the patient has to say. And then the physical examination plays into that. I think pain drawings, especially with spinal problems, are a wonderful tool to use to help the physician to make a diagnosis, and that simply means that the patient draws out on a sketch where the pain is occurring and where it may radiate to, where it originates, where it stops. And then there's the diagnostic studies, the plain films, the CT scan, the MRI. Sometimes it's important to get a bone scan or a bone density. You talked about osteoporosis earlier. Bone densities are essential in that type of a situation. Now, as I said earlier, everybody's not going to be a candidate for A2M treatment, alpha-2 macroglobulin treatment. So you have to analyze the joint, make sure that there's not a lot of joint destruction, make sure that there's not a lot of instability of the joint, that it's not flopping all over because then it's going to need to have a procedure that reestablishes stability. And if the cartilage is too far gone, then you're going to have to start thinking about either a fusion or a joint replacement. But in those situations where there is adequate cartilage remaining, where there is no evidence of gross instability, then I think it's a very wonderful option. It's a very easy option, almost pain-free. I mean, it does involve a needle stick, and the treatment usually occurs under X-ray control, but some joints lend themselves to easy access, like the knee joint you really can do in your office. The ankle joint you can do in your office, but some joints, the hip and certainly the spine, have to be done under X-ray control. There are situations...
Meaning that so you know exactly where the needle's going by being able to observe the injection.
Exactly. You need to put the patient on a fluoroscopic table, use what's called a C-arm, and allow the C-arm to identify where you're putting the needle so you can get the medication delivered to the right location. Now, there are ways in the office that the needle can be directed using ultrasound as well. So that's another way that sometimes we use to help guide where we're placing the medication.
Now, one injection, is that usually enough? And then what is the course following that for the recovery?
The vast majority of patients that I've seen, I've just given one injection to. Now the treatment is about 4 years old, so it's possible that I'll start having patients come back to me and ask for another injection. But I actually thought that people were going to come back to me sooner. Now, there have been people in a whole different set of circumstances that have had 2 or 3 injections, and these have been competitive athletes who have, there's been a handful of them, not a lot, who have asked for the A2M prior to a competition and then gone and done the Ironman, gone and done the jiu-jitsu tournament, gone and done the marathon, and then have wanted another injection after they finished it. So there have been some unique situations like that, but by and large, most people that we've treated to date have just had the one injection. Now, if it doesn't work, this is not for everybody. It's not going to work in everybody. When it doesn't work, then I think you have to look for some other type of treatment. I haven't thought of trying it a second time.
What percentage, and I'm trying to get an idea how many of these procedures, these A2M injections, how prevalent is it in the United States, the number of doctors, and what is the ratio between success, let's say, and where it's not working?
Well, Brian, I was recently giving a talk at a meeting in California where people were discussing all biologics, and I was very, very shocked, delighted really, that all the participants knew that A2M was the front runner. Maybe a year ago that wasn't necessarily the case, and we were having to present our argument as to why this should be done. But I think people have gotten educated, physicians have gotten educated, and I was delighted to see that there was more knowledge about it. As far as how many cases are being done, well, at this course it was a course for physicians that were learning the technique. There were about 20 participants, so they were all going to go out, and they all had patients lined up. So I'd have to say, Brian, that there's been thousands of cases done to date all over the country, private offices, major centers, and I think the results really have been outstanding. We won Best Paper at the International Pain Society, myself, and I've mentioned several times before the outstanding work that Dr. Gaetano Scuderi does, and we won Best Paper for our paper on the use of A2M with one of our other colleagues who's in Los Angeles at Cedars-Sinai, Dr. Cuellar, Jason Cuellar, who actually was originally my patient, then my student, and now he's a fully trained spine surgeon working in Los Angeles now. So
Wow.
It's been a great experience to have that type of friendship build over the years. But getting back to the question that you were asking, the success rate, in our paper, what I haven't discussed is that there's also a way of telling whether or not the injection's going to work, and it's whether the patient is positive for what the NIH calls a biomarker. Every disease has or will have discovered a protein that has to be present that indicates that it's in an active state. And when this protein has been identified, is present, then we've had about a 95% success rate. If the protein's not present, then the success rate's been less than 10%. Now, at this point in time, it's a little bit difficult to test for this biomarker, but I believe 5-6 years from now, you'll have MRI technology that'll not only include imaging, but it'll include being able to dissect out the chemical composition of different tissues, your cartilage, your joints, your ligaments, and it'll be able to identify through MRI spectroscopy, which doesn't really exist today, but I think you'll be able to identify if the individual is biomarker negative or positive. Now, you just have to rely on your physician hopefully being a good clinician, a good diagnostician, and being able to diagnose you in that way. But, as a patient, you have to understand that there is a chance of failure with any kind of treatment, and there's a chance of failure with A2M treatment as well.
Mm-hmm. Now, you treat all types of people, obviously, age being people can be elderly and they may have different, their joints may be deteriorated over time, may not be candidates, I assume, right?
That's correct.
Is age a big factor in who can get A2M?
To date, we've been giving it to all ages. I probably wouldn't go below a teenager in using A2M. I don't know what the literature is out there. I'd have to look at that to see if there's other clinicians that have been using it in younger individuals. But I think the youngest person that I've given it to has been in the teens.
We have a perfect example of that here with our special guest, Jonna, who is a 13-year-old who's been experiencing her own spinal difficulties. Jonna, how are you? Why don't you tell us a little about that?
Yes, it is not comfortable sometimes. It's an on and off pain, a lot less now than it used to be, but I used to have it really bad. And my doctor gave me some great advice. All he told me was to just suck it up, but I couldn't really do that. So one day, we finally got an MRI. Turns out, nothing was wrong. It was just something I had opened up my joint, and so it made it hard whenever I sat down. So that's why that was my pain right there.
Well, we have your doctor happens to be here right now, and I'm going to let him talk to you a little bit about your characterizing his treatment process.
Well, I think that was good advice that you got from your doctor, I think, really, and I guess it paid out because the pain has gotten less. But how did it start? Why don't you tell us how it started? What were you doing when it started? And how did you have to modify things after that?
Yes. Well, I first felt the pain when I was kicking.
Kicking? Now, what do you mean? You were kicking a ball? What were you kicking?
I was kicking a pad.
A pad. So this sounds like some type of martial art or fighting style. Is this what you study? What styles do you study?
I do jiu-jitsu and taekwondo.
Now, are these optional things that you participate in, or are these more or less required?
It depends on whose perspective you're looking at.
So it sounds like you have a more traditional family or parent who's concerned about you and wants to see that you possess in life all the skills necessary to not only advance but protect yourself. The injury occurred while you were kicking, and it occurred to your cartilage. The cartilage opened up, and initially the treatment was just to try to follow it and treat it with what we sometimes call benign neglect. And as you noted, your doctor told you to just suck it up. And by the way, what is your full name, Jonna?
Jonna Montesano.
Oh, it sounds like we share the same name. I think I recall that I, in fact, am your doctor. I guess I was not only your father, but your doctor. And it sounds like you got good advice because your pain did get better. But when it persisted beyond about a 2-month period, we did do a workup because we were concerned that it could be something else. And, always when somebody has back pain, there's a very low percentage chance that it could be an infection or a tumor, and this needs to be addressed. Not initially, because 90% of pain is going to diminish after about 2 months. But when it doesn't diminish, this is when it's prudent to do a workup. We did the proper workup, and the workup came back negative. You sustained an athletic injury. It was actually of your coccyx, so a little bit further down. And we had to treat that by taking the pressure off of it, modifying your training regimen, and treating you with oral anti-inflammatory medication. And the pain has continued to get better, and now it's gone from being constant to intermittent. Although recently, when you went to an event and you had to sit for a prolonged period of time, you had a little bit of an exacerbation of it. Isn't that correct?
Yes.
I guess to make a long answer short.
That's the kind of answers I like.
Now,
all right.
Were you happy with the initial prescription, which was to suck it up?
No. No, I was not, because I don't think he understood that I couldn't just suck it up. It was there.
Well,
I couldn't do anything about it.
Would this be a part and parcel of an overall philosophy in growing up and facing matters in life?
Yes. Yes, it would be.
I like it.
Well, I'm very proud that I have. She's an excellent student, excellent athlete, and just overall an excellent daughter.
It sounds like she's got your work ethic when it comes to working out and kicking and punching and.
Well, I think she's better than I am, but anyway, I think she is recovering. No, I was a little bit worried initially. I went through a phase of thinking, okay, it's just a minor injury and it's gonna pass. But when it didn't pass, I got a little bit worried, both as a father and as a physician. But we had to be patient. We did the appropriate workup. Was a little bit worried that there could be something else going on. It turned out that it was just a ligamentous cartilage injury, and it's slowly been healing, but she re-injures it every once in a while.
Well, that I guess comes with just when you're young and you're an athlete, you may tend to overdo it, and I think that is kind of what a lot of athletes do. They tend to try and they don't realize when they're maybe doing damage to themselves.
I think that's right, Brian. That's very right. If you look at different sports, you'll notice that different states seem to have put different positions into the pros. Now, for instance, those states that are warm weather, where you can play the sport all over all around the year, some of the key positions tend on getting injured more. So you see, for instance, a lot of pitchers are coming from colder weather environments where they can't pitch during the winter, so they have that time to rest, where some of the warmer weather states, they contribute their fair share, if not more, to the first baseman, second, the infield, the outfield. But you see that the pitchers sometimes suffer from overuse in those sunshine states, and they end up injuring in a more permanent way their arm. It's often said that the best pitchers, when they were in Little League or in high school, there was another pitcher who was a little bit better than them that protected their arm because they went into the rotation more. And then also sometimes you see on different teams, different school teams, high school teams, college teams, that if there's a guy who's too good, there's an example of this that we've had. You know, we talk about the Roseville Health and Wellness Center, which is a facility that I helped to develop and I'm very proud of still exists, and I still see patients at every once in a while out in Roseville, California. We talked about how we've had some athletes there who had overuse syndrome simply because they were so good that other students who played the same position, quarterback, etc., weren't going to their school. So there wasn't another guy. There wasn't a backup. So that person ended up having an overuse syndrome, and you know it's hard. You have to sit down with the parents, sit down with the coaches, sit down with the player, and explain what's necessary for recovery.
You're listening to Dr. Pasquale Montesano, MD, of the Montesano Spine and Sport, with offices in Palm Beach Gardens, Miami, Naples, San Juan Capistrano, California, Rome, Italy, and soon in Las Vegas. This is the road to better spine health. If you want to know more about Dr. Montesano, if you want to give him a visit, maybe you have a lingering back issue that you've not been able to get results in treating. Another doctor has told you maybe surgery is your best option. You're just uncertain about how to proceed, and yet you have this nagging pain in joint or in your back. Go to Dr. Montesano and let his unique methodology work for you, because he is super experienced. He is one of the top orthopedic surgeons in the world, and he is now, and we're so fortunate to have him in South Florida with his office in the Gardens and in Miami, that it's truly a treasure having you here and having the opportunity to be able to be treated by a man of your renowned expertise. But contact him at 866-79-DR-SPINE, 866-79-DR-SPINE, or visit him on the website spinedocs.org, SPINEDOCS.org. Find out more about Dr. Montesano's practice, about his history, his education, and you'll agree that you couldn't pick a better orthopedic surgeon to help get you better and get you back on the road to better spine health. So I did want to, talk a little bit about competition with the younger people, and as you mentioned, let's say, a pitcher being in a warm weather state such as Florida, our parents and the coaches, there's this competition, and I know we've kind of gone in a way where a participation trophy is all you get now. But truly, with the competition, children want to drive themselves, and they may have a parent that want to drive them more. Are they overlooking that need for rest and that need for a rotation, let's say, to work toward longevity and not a premature breakdown of your critical joints?
I think you're absolutely correct, Brian. And you have a lot of people that are putting a lot of pressure on these young athletes, the coaches, the parents. And I think that there has to be rest given that's appropriate rest. There has to be interval training. And I think there has to just be common sense that sometimes we lose sight of.
Mm-hmm. Yeah, because, that need to win, that, win at all costs, and you see the mentality of it in the pro sports and the college sports, and then you're starting off kids. And I know I've heard of parents who start their kids off, very young age, and they get them into regimens and push. And I suppose there's a breaking point at some point, or there has to be a happy medium in there.
Well, there has to be a three-letter word that we overlook sometimes, and that's fun. And it has to be fun. Once you push it to the point where, somebody else is living out somebody else's dreams, then you come into a situation where the person they're not concentrating, they're ignoring some fundamentals, and all of a sudden an injury occurs, and then they're being pressured to return before the injury is allowed to heal. So it's a very dynamic situation.
Very, very competitive, and I know there's a lot of money to be made if you're a high-level athlete, and I guess that's part of and the prestige that goes along with that as part of the push. How does it work in with the participation aspect of it? Is there a middle ground where you can be competitive and still not over push the children, make them realize that we all want to have fun and you're going to get a trophy just for being out there, as compared to the exceptional athletes that want and need to excel?
Brian, we've said a few things here that are almost contradictory. There has to be a middle ground. So we talked about no pain, no gain, but we have to temper that, and there has to be a certain element of common sense that's used. And if there is a significant injury there, then we have to rely on rest and putting other people in the rotation if it's that type of a position where you can overstress joints, like we talked about pitchers before. The same would be true about fighters, wrestlers, boxers. There needs to be a time for rest, and also the quarterback position is a position that can get that's subject to a lot of overuse syndromes.
Mm-hmm. And basketball, I know I was a big basketball player growing up because it was easy to do. You needed a ball, you could go out to the park, and you could play. But a lot of injuries occur from basketball, especially knee type injuries, ankle injuries, and do you see a lot of that?
Absolutely, Brian. The thing is that you have a situation where the individual athlete, the basketball player, can be playing in 2 or 3 leagues simultaneous. So, and the nature of basketball is there's not a lot of time in between games. It's one game every night sometimes. And then you've got pickup games and social games, and I actually see more high-level athletes that get injured in the corner pickup game than they do in the organized game. So it's difficult, but I think you have to stress that each individual is an individual, and there has to be some common sense.
You've been listening to the Spine Doc, Dr. Pasquale Montesano, MD of Montesano Spine and Sport. That's going to do it for this week's show. I just wanted to remind you once again, contact Dr. Montesano's office. Let them know what your situation is. Arrange for an appointment. Go in there and have Dr. Montesano look you over and evaluate what your problem is, whether it's lingering back pain, trauma, just wanting a second opinion. He's the man to see because his credentials are impeccable. We're so thrilled and pleased that Dr. Montesano is in our area because he offers a road to better spine health and better joint health than other doctors are not aware of or do not have the training or background that Dr. Montesano has. So I can only tell you to check him out and see what he can do for you. Dr. Montesano, thanks again.
As always, Ryan, it was wonderful being here, and I look forward to our next meeting.
You've been listening to The Spine Doc with world-renowned orthopedic surgeon Dr. Pasquale Montesano, MD. For more information, visit us on the web at spinedocs.org. That's SPINEDOCS.org. Or to make an appointment, call 866-79-DR-SPINE. Join us again next week for The Spine Doc, putting you on the road to better spine health. Better spine health. Better spine health. Better spine health.